Today we will go through another interesting case. This is the CT scan paranasal sinuses of a young patient who presented with complaint of headache and right frontal swelling. So here we can see there is complete opacification of the right frontal sinus and anterior ethmoidal ear cells. There is also expansion of the sinus cavity with thinning of its walls. These are the coronal sections. Here we can see there is significant expansion and thinning of walls of the right frontal sinus, which is bulging into the right orbital cavity and displacing the right orbit. There is no evidence of residual air in the sinus cavity. This is the soft tissue window. Here we can see there is no evidence of any enhancement within this soft tissue opacification. The posterior wall is intact and there is no evidence of any intracranial extension. So these are the typical imaging features of mucocele of right frontal sinus. Paranasal sinus mucoceles are benign expansile epithelial lined cystic masses consequent to obstruction of sinus ostia and accumulation of mucous secretions within them. The predisposing factors are inflammation, trauma, previous surgery, cystic fibrosis, anatomical abnormality, or aneuplasm. About 70 to 90% of cases occur in the frontal sinus, followed by ethmoid and sphenoid sinuses. They can cause significant expansion of the sinus with mass effect on the adjacent structures. Orbital involvement causes proptosis, diplopia, restriction of ocular movements, and periorbital swelling. Intracranial spread can lead to meningitis or seizures. CT is particularly useful in delineating the bony anatomy and for surgical planning. The affected sinus is completely opacified and the margins are expanded and usually thinned. Area of complete bone resorption may be present, resulting in bony defect and extension of the mass into the adjacent tissues. Peripheral calcification is sometimes seen. Only peripheral enlargement is seen within them. The presence of air within an affected sinus rules out the possibility of mucocele. MRI is the best in assessing the extent of the lesion and to differentiate it from other soft tissue neoplasms and brain parenchymal involvement. 5 types of frontal sinus mucoceles has been described based on the extent of erosion of the sinus walls with or without intraorbital and intracranial extensions. Number 1 type is limited to the frontal sinus, which can be with or without orbital extensions. Number 2 is frontoethmoid mucocele with or without orbital extensions. Erosion of the posterior wall sinus, which can be with minimal or no intracranial extension or with major intracranial extension. The 4th type is erosion of the anterior wall, as we have seen in our case. And the last 5th type is erosion of the both anterior and posterior wall. Treatment may be drainage of an affected sinus. If large bony defects are present, reconstructive surgery may be necessary, for example of the orbital floor. If the drainage remains impaired, the mucocele may recur. Thank you.